And there we go. So I should be live on Instagram and YouTube at the moment. I think they're still kind of trying to work out some of the kinks and everything, so. And it looks like we're doing okay right now. It looks like we'll be live on both platforms, YouTube and Instagram at the moment. So I just want to say again, if you are on Instagram, I highly suggest you check out the YouTube channel. Instagram, I'll show you, I have my phone right here sitting on top of my monitor. I don't really get to do any cool special things on Instagram, whereas on YouTube there's some video editing software. I can show you guys pictures, things like that. So if you are watching this on Instagram, I highly suggest you hop on over to YouTube channel, check it out, watch the live video from there. For now, I will be taking questions from both, which right now doesn't seem like too many people have many questions. So if you do have questions, occupational therapy related questions, feel free, type them in the chat on YouTube, type them in the comment section on the Instagram, and I'd be happy to answer whatever questions you guys have. Before I answer any questions, I do want to give a little introduction for myself, as well as on YouTube here. You won't be able to see it on Instagram, but on YouTube I'm going to put up a disclaimer for you guys, just to let you guys know that I am here and I can answer questions. However, although I am a practicing and licensed occupational therapist, I absolutely am not able to diagnose anybody. I really can't provide any direct advice for your child. I'm not there with you. I'm not there with your child. I can't see them. I can't, feel their muscle tone, anything like that. So anything that you take from these videos or these live streams is completely at your own risk. This is just general knowledge sharing from my experience. I'm not I'm not even recommending anybody do any of these things to their child, especially without consulting a pediatrician first. Going to an actual occupational therapist is always going to be more beneficial and more effective than, trying to implement anything you see on the internet by yourself, because they're going to be able to assess your child. They're going to be able to look at them, give testing to them, and they're going to know exactly what's appropriate for your child. Where general information, it's appropriate for some children, and it may even be appropriate for most, but there's always going to be the case where it may absolutely not be appropriate at all for a child and could actually end up harming or risk harming them, things like that. So always consult your pediatrician before you're doing any kind of medical intervention. And always, just anything you take from these videos, use at your own risk. So does anybody have any questions for me? I'm gonna give you guys a little bit longer, maybe a couple more seconds. And if nobody's got anything for me, then I'm just gonna talk. I like talking. I like talking about myself. It'll be fun. So, maybe it'll spark some questions if I explain a little bit about what I do and what occupational therapy is, because I know that a lot of people may not know. Usually when I first tell someone, hey, I'm an occupational therapist, that's my job, that's my profession, they're always like, well, can you get my cousin a job? But That's very common, but that is not what occupational therapy is. My job is not to help other people get jobs, even though occupation is in the title of my job. What I do is I am a therapist, and much like a physical therapist, which I know is much more well-known, or a speech therapist, my goal is to help people get better or get back to doing what they were before, or in the case of children, to teach them new skills and help support them as they grow and develop. So it is an actual therapy. It's not, like a job finding thing or anything like that. So what I do, it kind of falls in the cracks between physical therapy and speech therapy and the other ones, so a physical therapist is going to focus on trying to get I'm going to talk in a pediatric sense, since most people here are looking for help with their children. But in the pediatric world, in the children world, a physical therapist is going to work with trying to help your child get stronger, trying to increase your child's endurance, try and get them moving without losing their breath too fast, things like that. They're going to try and help get your child mobile. So if they're unable to walk, they may look into other options, like using a special adapted walker or wheelchair, teaching your child how to use it, teaching you all the features and everything. So physical therapy really focuses on strength, mobility, balance, things on that nature, which are obviously hugely important for anybody, children, adults, everybody. Everybody wants to be able to move throughout their environment. Speech therapy focuses on, as in the name, speech. But they have a very wide range of topics they can go into. So they can focus on the little oral motor minutia, like the v sound as opposed to the f sound, and getting your child to say those two sounds and working with them that way. They also can focus on the language portion of speech. So your child may not have any difficulties pronouncing anything, but when they say a word, they may not actually understand what that word means. Or they may not understand that when they say this word, and this word all together, they may not understand that makes a sentence, or know how to formulate sentences, or know the difference between the words in, on, above, below, prepositions. So when they talk, it's hard to understand what they're saying because they're flip-flopping words and they're not making sense. Speech therapists can also work on feeding. So they do a lot of the ocular motor stuff, being able to form different sounds between your teeth and your mouth, your lips. So they also work with eating, because that uses your teeth, your mouth, your lips. They'll work on chewing. They'll work on, they have different techniques to be able to get your child to be able to chew, swallow, everything safely so that they can eat safely. And what I do, I'm not a physical therapist or a speech therapist. I am an occupational therapist. So that kind of, like I said, I feel like it kind of fills in the cracks. It's kind of everything else. So one of the huge things that I work on as an occupational therapist is fine motor and hand skills, which is very important because think about it, when you're going throughout your day, what are you using to interact with your environment? How are you going to open a door? How are you going to put your shirt on? How are you going to type that email or write that letter? It's your hands. So that's one of the big things I work with, being able to rehabilitate hand, fine motor coordination. I work with nerve injuries, skin injuries, just basic strengthening and coordination, handwriting, things like that. It covers a lot. It covers like ocular motor function. It covers attention, behavior, executive functioning. Basically, if your child needs to be able to complete a task and they're unable to do so, it is my job to figure out why. So, an example I like to use is if your child needs to button a button. and they can't do it. And take them to see me, and I'm going to watch them. I'm going to watch them try and button that button, and I'm going to see, okay, they're not able to button the button. But why? Is it because they don't have the fine motor coordination to be able to button that button? Is it because their pinch strength isn't strong enough to actually hold the button? Is it because their eyesight, their ocular motor function, they're not able to focus on the button to get it through the slot? Is it because their attention? I mean, if they're sitting there with their button in front of them and they can't focus on the button because there's too much other stuff in the room going on, or their minds just can't focus on the task, they're not going to be able to put that button in the hole. Sometimes it's a matter of behavior. Does your child want to put the button in the hole? But obviously, in that case, you want your child to be functional. You want your child to learn dressing and buttoning skills. So if it's a behavior issue, that also needs to be worked on to ensure that your child is growing and learning the new skills that they should be at the age-appropriate times. So my job is to look at your child, say, okay, they're not able to do the button. Why? And I'll find out why, and I'll break it down into little pieces or figure out where the problem is coming from and work on it from basically the small levels first, all the way up to getting your child to do the button. So basically that is my job in a nutshell. Obviously I don't just have kids button buttons all day. Like I said, it encompasses anything your child may need to do, and it encompasses any problems that they have doing it, whether it's a physical muscle tone problem or whether it's a behavior problem or anything. It's my job to look at your child, look at what they need to do, and figure out how to get them to that point where they're able to do it and be as functional as possible. So it looks like I have a question coming in on the YouTube channel. I think everyone's being a little shy today, but I do have one question. So here's what I'm going to do. For those of you who are just tuning in, what I'd like to do, it won't show up on Instagram, but on the YouTube channel, I would like to put your question right up on the screen while I'm talking about it. And that way, if somebody tunes in a little late, they won't have to, try and rewind the video to figure out what I'm talking about. Okay. You know what, that's a little small. I'm gonna make that a little bigger. And like I said, I'm sorry to the Instagram people who aren't able to experience the whole YouTube experience with, I'm basically, if you're watching from the YouTube channel, you're going to see things pop up on the screen, things like that. So if you would like that experience, hop on over to the YouTube channel. It's Raising Beautiful Little Minds. I'm live there right now, and yeah, subscribe. And I should be doing this, I know for a fact I'll be doing this next week, Saturday, same time. So if you go on there, take a look at it, subscribe to it, you'll know when I'll be on again, and I hope to see everybody there. And I hope people feel free to ask me some questions. Feel free to, don't be so shy. Part of the show is revolved around you guys, so if you don't ask me anything, then I'm just going to sit and talk about myself, which is great. I don't mind talking about myself, but I also want to know what you guys want to hear. So, first question, I already have it up on YouTube, is my child struggles with getting dressed in the morning, specifically zippers and buttons. Do you have any tips or tricks for that? So, very common problem. Lots of kids I see have the specific problem, specifically with buttons and zippers, and we'll even throw in shoe tying and things like that. So, when you're looking at this, you need to look at how old the child is first, and whether or not this is an age-appropriate activity. So, it's very difficult for me to say if your child is 3 years old, yes, they should definitely put that button in that hole. That should not be a problem, because all children are different. All children develop differently, and you know, it's not always clear cut. But I will say that if your child is around 4.5, and they're still struggling with that button, that should be an indicator that maybe something is a little off, something they might need some extra help. For a button specifically, and this is why I wanted to do this on YouTube, I have a couple really cool tricks for that. So give me 1 second, and I'm going to pull up a picture to show you guys. Okay, so on YouTube, I'm going to change over the screen to show you this picture. On Instagram, I'm sorry, you're gonna have to use your imagination. I'll describe it to you. But so over here, as you can see, is a picture of button sorting cups. Basically, for the Instagram people, you can take any container. It could be like a peanut container, anything with like one of those plastic floppy lids. Cut a little slit in it, and then see if your child can take that button and put it through the slit. If it's the first time you're doing this and you want to make it a little easier for your child, make that slit a little bigger, a little easier for you to slip that button in. Once they become comfortable with that, you may want to make it a little smaller. You may want to make it so that they have to put something wider in there. They actually have to push it through, form some resistance there, strengthen those finger muscles to be able to do that. That would be step one, because that involves being able to pick up something very small, very thin, and precision place it into a slot, which, if you think about it, is one of the main parts of putting a button. You're putting a button into a small hole. So a huge thing with what I do is just practice. You need to find an activity that replicates what you're trying to do. You need to make it easy enough where the child is successful, but still create that challenge for them so that they can get better. And as they get better, you want to increase the challenge all the way up to the final task, which is putting that button in that slot. So the buttoning cups is a great place to start there. And then I also wanted to show you, I'm just on Google Images right now, so they have lots of cool stuff, and this is stuff I use in the clinic as well, not this specifically. I will have to bring some of this stuff in for you guys, or bring it home for my clinic so I can show you live how to manipulate it and how it works sometime. This picture here is a button snake, and for people on Instagram, what it is it's a long ribbon with a button at the end of it, and basically little felt shapes with slits cut in the middle. And this is a great way to practice buttoning with your children, because they're going to have to take that little button, put it through the felt slips, and then pull it out the other side, which is teaching them that whole task of putting the button in one side and pulling it out the other side, which is, it's a fairly complex fine motor task, especially for a young child to learn. And if they're having other issues in the fine motor realm, it's increasingly difficult. So this button snake is a good way to practice and address that kind of thing. Now, once they're doing this, you want to move on to practicing on real buttons. However, you don't want to give your child a tiny little button and say, all right, you can do the button snake now. Now you can do this little tiny, little itty bitty button. No. You want to start out with a big button, even like this big. You might want to get creative, DIY one out of felt, raid your closets. I'm sure you've got a big coat with the big buttons. That's where you want to start with, because the bigger the button is, the easier it's going to be for them to grasp it, first of all. The easier it's going to be for them to pinch it, because it's not so small where they have to use a superior pinch. They can use more of a lateral pinch. And the easier it is for them to see the button going through the hole and to be successful with it. Once they're practicing with that and they can get it through that hole over and over and over again, you want to decrease the size of the button and keep practicing. And hopefully the aim of all this practice and all these different activities and the cool button cups is that your child will now be able to do a button on their own shirt. So that's buttoning. One of the other things mentioned is zippering. Zippering is also tough for children. If you think about it, it is a bilateral task, which means it uses two hands. Nobody can latch a zipper and pull it up using just one hand, unless you're more skilled than I am. I know I can't do it. So how I like to teach zipping is through a method called backwards chaining, which is going to sound kind of weird, but it makes sense, so bear with me. Backwards chaining is a method of teaching a child where you start at the end of a task, and then you have them master that part, and then you move up to the beginning of the task. And the backwards chaining usually works when the beginning of the task is the hardest, because you don't want to teach a child a task and have the very first thing that they do just be the hardest thing they've ever had to do, because they're going to get frustrated with you. They're going to shut down. Having your child zip their coat should not end in tears type of thing. So what I would usually do, and maybe I can run and get a zipper to show you guys. I would be right back. I'm not going anywhere. I'm just grabbing a zipper. I'm still here. So this is just my jacket. Like the buttoning too, when you're practicing, do not choose the smallest zipper you can find. You definitely want to choose a larger zipper if you can. They may even, I could take a look, they may even sell some zipper tools for teaching how to zipper. Give me 1 second. I'm not seeing anything immediately, but if I find something, I will put it up on my Facebook or my Instagram. By the way, I have a Facebook and an Instagram, so please follow me. My name is OT Steph. Everything's just kind of starting up right now, so there's not too much stuff going on, but follow me because I promise there will be more stuff coming in the future. I will post activity ideas, things like that. But I'm getting off track now. I'm not finding anything I really want to show you guys with the zipper. But choose a big zipper. If you can, the biggest zipper you can find, you always want to start big and work your way to small or what is going to be functional. So I do not have a giant zipper, so I'm using a normal size zipper to show you. So when I'm teaching a child how to zipper, I will backwards chain. So I will latch it for them and I will say, okay, now zip it up. Because when they're zipping, let's see if I can put this how you would actually hold a zipper. When you have to zip a zipper, you actually have to hold it with one hand and zip it. Oh goodness, I need OT. There we go. So you have to hold the bottom of it with one hand and zip it up with the other hand, which a lot of kids struggle with. I've seen you tell a child to zip and they're gonna hold it up here and then try and zip it up here. You've gotta, and sometimes you have to take the kid's hand and put it here and say, nope, hold it here, zip the zipper this way, pull away from it, and see if they can practice that, see if they can replicate that. Even if you start by holding it down here and having them just pull, then you want to have them hold it down here and pull it themselves. Once they get that down, a good way to practice is actually that pre-buttoning tool. Putting something small in a small hole or a small slot. Some practice with that is going to get them better with putting something small into a small hole or a small slot. And then once they're able to do that, they're already going to have mastered this skill. So that's that. Now, of course, I made that look easy because I've been zipping my own jacket for quite some time now. For your child, this may take days. This may take weeks of practice. And these are just, like I said, some tips that you can try. Now, there are, you know, certain medical diagnoses and ailments and things like that, that it may be the case where a child is just not going to gain that ability to zip a zipper, and that's okay. If that's the case, they do make tools where you can zip a zipper, or I've actually just seen a video where, oh goodness, I don't remember what it was. Some clothing company just started coming out with shirts that have buttons that are magnetic. So you don't even have to sit here and do the task. You literally just have to take the shirt, one end of the shirt, pull it over the other side, and the buttons just kind of click together. And that's made for people who struggle with these kind of things. So there are other options out there, you know, if you're struggling with this and it's not looking like, I mean, this is why it's hard to do a video like this, because that specific question, there would be a different answer for it for every single child that is struggling with doing a button, and it just depends on why they're struggling. If it's just the pinch strength, if it's just they need practice with it, they need different tools to practice with it, that's one thing. But for instance, if a child has cerebral palsy, and you know, cerebral palsy is a disease that it's not a disease, sorry. Cerebral palsy is a injury to your brain that happens in the cerebellum, which affects your motor movements, it affects your muscle tone, and a lot of times the prognosis for that is it doesn't improve, you know, throughout your life. You can use therapy to kind of try and maintain the skills you have, but a lot of times it's difficult to gain new skills. So if that's the case, that's when you'd want to start looking into adaptive equipment or special types of shirts that don't require buttons and zippers. So yeah, that is a broad answer to that question. Is there anybody else? That was the only question I've seen come through. I'm gonna double check and see if there's any more on here. I figure you guys would have more for me. I'm going to take a drink of water because I feel like I just talked my throat dry. And while I do that, please don't be shy, ask a question. It looks like I just had one float in here. Let's see. Oops. So, question I'm seeing, are certain letters easier for kids to write than others? So I'm going to pop this question up on my YouTube stream before I talk about it. Let's make sure that worked. Okay. So the question I just received is, are certain letters easier for kids to write than others? And the short and simple answer to that is yes. If you think about it, and I'm talking about the English alphabet, there are letters that are very simple to write. Like a lowercase letter L is literally just a line down. So as long as your child is able to draw a straight line down, they can write a letter L. And then there are far more complex letters. And when you're talking about handwriting, this is a really, really huge subject. So it's difficult to talk. It's difficult to talk on a broad level of it because there's so many aspects to it. But trying to focus on the question, When you think about a letter, there's a whole bunch of different things that go into it. The actual formation of the letter. Maybe I can... Sorry. I'm just trying to think of a good way to... No. Alright, let's pick a letter. Let's pick the letter G. Okay, so, and we'll do the lowercase letter G, just for an example. So I'm going to finger spell now. The lowercase letter G is going to come around in a circle, go down, loop around. So the formation of the letter. Now, if you were going to draw the tail first and then draw the circle on top, that would be improper formation of the letter. And that's going to lead to a sloppy looking G. There's also the spacing of the letter. So when you're writing on lined paper, you want that G, a lowercase letter G, to fit in the lower bottom half of that line and then actually go and curl below the line, which is very difficult for some kids to figure out how to do that. So even though they may have completely appropriate formation, they can make a beautiful lowercase G. Where they put it on the line is going to matter. It's going to basically, is it going to look like a lowercase G, or is it going to look like this weird floating G in the air? So there's a lot more that goes into writing a letter than just what the letter looks like. And then when you're talking about writing a word, is that G, in line with the other letters, or is there a huge space between the G and the next letter, or is it so close that the other letter is infringing on that G? So to answer your question, there are certain letters that are easier to write, to do the regular formation, like an L. But in the handwriting world, even if those easy letters are easier to form and write, they may not always still look legible in a word or a sentence form. If you have any... I don't know if I answered that question. I hope I answered it a little bit. But if you have any specific questions about, like, how to write a particular letter, I could maybe answer that. But, and it looks like the storage on my phone on Instagram, I just popped up with a message saying that the storage is running out. So I don't quite know what that means. I don't know if that means that the Instagram stream is just going to cut out on me eventually or what. But if that were to be the case, I am on YouTube. I am streaming on YouTube. The channel is Beautiful, Raising Beautiful Little Minds. I am live, OT Steph. If this cuts out, please hop on over if you're finding any of this useful or helpful or informative. Let me know. This is the first time I'm doing this, so I really don't know what I'm doing. I hope I'm doing okay. I hope this is informative for you guys, but let me know if it is, so that, we'll continue doing it, of course, if you guys are enjoying this. But so yeah, I'm gonna take a quick drink of water while if there's any other questions that want to come in, I'd be happy to answer them. How's everybody doing? Even if it's not a question, even if you just want to introduce yourself or say hey, or whatever you want to do. It is 1:37 here, so I've been talking for 40 minutes now. Does anybody have anything for me? If not, I'm going to talk about myself a little more. There was actually a question that came in a couple days ago that maybe I'll answer now, since nobody has anything for me. And I don't remember the specific wording of the question, but I know It had to do with what the person said was air writing, which this will, and I put it up on YouTube, I think. Let me double check that. Sorry, guys. Okay. The question had something to do with my child likes to write in the air with his hand, repeatedly. And, what is this and how do I stop this? And I don't know the child that was in reference, so I cannot say specifically, what is going on with that child. Like I said, I can't diagnose or treat an individual child, but I can talk a little bit about stimulation, or what is more commonly referred to as stimming, which is very common for children who are diagnosed on the autism spectrum disorder, with the autism spectrum disorder. So, autism spectrum disorder is a disorder that oftentimes heavily affects your sensory system. So, to backtrack a little bit, give a little background information, your sensory system is composed of a bunch of different things. Your eyesight, your hearing, your ability to feel things with your skin, your nose, your smelling, your taste. Those are the five big ones that everybody knows. There's also a couple more that people don't know. One of those is called proprioception, which is a big one that isn't talked about very much. And what that word means is basically the feeling of your body in space. So right now, while you're watching this, if you're sitting in a chair, you know you're sitting in a chair because your legs are likely bent. Your bottom is probably secured to the chair. You can feel the chair pushing back against your bottom. I can feel the desk touching my hand. This isn't quite the same as just touching, feeling, like being able to feel if something is fuzzy or the texture of it. This is actual input into my body telling me right now I'm sitting in a chair and this is what's going on. For children with autism, these sensory mechanisms, there's a miscommunication between them and the brain oftentimes. So in a regularly lit room or on a sunny day, you or I might be like, oh, it's light outside. But a child who's on the spectrum, that may be blindingly bright. It may be, it may have been hurting their eyes. It's so bright because that information that's coming in through their eyes, it may be magnified going to their brain. Or it could be that, the signal's not strong enough. So we have enough light to see right now, but a child with sensory processing disorder, which is common for ASD, it may not be enough light for them to visually discern and pick out anything. Same thing goes for hearing. A regular noise, the buzzing of I can hear the buzzing of my computer right now. It's very faint, but if I listen for it, I can hear it. But a child who is on the spectrum, who has a sensory processing disorder, may be able to hear that like it's blaring in their ear. And then, so imagine that. Imagine, you're sitting in a classroom, you're trying to learn, but the lights are blinding you, and the buzzing of the light bulb and the light is, you can't hear anything because it's so loud to you. And then you're expected to learn how to do math, or you're expected to button a button. So, a lot of times, these kids, they're so overwhelmed on the inside with all of the sensory information that's just not getting processed correctly. They're so overwhelmed that they compensate for it. So the proprioception is the one I was talking about earlier, knowing the position of your body in space. So a child who has a sensory processing disorder may need more or less input from the things around them to know where they are. A lot of times when they stim, you might see something like a hand flapping. You might see them spin around in circles. You may see them like pick or scratch. And that is just their way of trying to regulate their own sensory system. Because right now they're sitting there, and it depends on what they're doing too. So a child who's sitting here, you know, scratching at his arm, they may have some sensory processing disorder for the tactile input, where, you know, as they go throughout their day, when they're touching things, that level of touch is not processed the same way it is for us. So they're sitting here, scratching their arm, trying to regulate that signal to their brain and trying to function a little better throughout their day. So there's a lot of background information for this question. I know I haven't even gotten to the actual question yet, but for proprioceptive input, you may see a child kind of bang into things or wave, because that's sending a signal of where their body is in space. So when I see a question like, how do I stop my child from air writing or writing letters in the air? That makes me think of a stimulation or something that your child is doing to try and regulate their sensory system. So if they're sitting here and they're flapping their hand, which, like I said, I don't know the child, so I don't know if that is actually what is happening, but that's just what it sounds like to me. To me, they're trying to get that input into their body. They're trying to regulate their sensory system. I know that this action may not always be a socially appropriate action. You know, when your child is in school and if they're flapping hands or scratching, you know, the other children may see that and go, what's going on? That's a strange thing. But it is your child's way of trying to regulate their system. And just saying, no, don't do that, stop, is probably not the best way to go about approaching it, because you're taking away something that is they're doing for comfort, and they're doing because their body is craving that, it's needing that. For one of the best ways to approach something like this is to figure out whatever they're doing, what sensory system are they trying to feed. So for instance, let's say your child babbles a lot to himself. He just makes constant noise out of his mouth. You can kind of discern from that your child enjoys hearing input. They like hearing noises. So they are creating their own noises to hear to help regulate that sensory system. So to stop that behavior of the constant babbling or screeching, what you want to try and do is provide that input for them in a more socially appropriate way. The solution for that may be to get them a pair of headphones so they can listen to music and get that input. And a lot of times I've tried that, and you know, the kid immediately their mouth shuts, and because they're getting that through something else. With the handwriting in the air, to me that seems like the movement. They're seeking that movement. They're seeking the proprioception of knowing their hand is waving in space. So provide them with an activity that requires lots of movement. Provide them with an activity where they have to use their hands in a gross motor movement way. So maybe playing with a heavy ball back and forth, or having them crawl across the floor with their arms. It's going to feed their system what it's looking for, so that they don't have to try and provide that to themselves through a behavior that may not be looked at as socially appropriate. I say this with a grain of salt, of course, because the autism spectrum is just that. It is a spectrum. It goes from children who have these mild problems to very severe problems. So, is putting headphones on a child the be-all, end-all cure, fix of any of this? Absolutely not. It may help some children, and it may not help other children. So that's why it's important to, if it's available, to always talk to an occupational therapist, because they're going to be the ones to be able to look at your specific child, to figure out what's best for your specific child. And sometimes that's through trial and error. Sometimes in my job, I don't know. a parent comes to me and they're like, well, how do I help my child, stop doing this or to do this? And sometimes I just have to try different things and see what works. You know what I mean? It's not always for every child that comes in with this specific problem, oh, that's the answer, that's the solution. Sometimes you just have to try different things, but having that overall understanding of the sensory system definitely helps. And having that overall understanding of why some of these behaviors might be happening helps, because then you can kind of figure out how to feed your child that same sensory input in a different way. So I hope that was helpful to that question. And like I said, I answered more than just the air handwriting question, but it's really better to look at it through a broader lens, and then if your child has different behaviors, you can apply that lens to all of them. So looks like we have a couple more questions coming in. So let's take a look which one's next. So I'll type this next one. Which is, the question itself is, you said you work on attention. Does this mean you work with ADHD kids? And the answer to that is absolutely yes. I work with children with all different diagnoses, and ADHD or ADD is one of them. For those of you who don't know, ADHD is attention deficit hyperactivity disorder. So think of the child that you see in a classroom or a store that just cannot stop moving, cannot sit down. They always have to be on the go. They always have to be doing stuff. They can't even, they would be bouncing around in their chair. They might not even be able to be in a chair, depending on the severity. So for working on attention, there's a lot of different ways to work on attention, but one of the most effective approaches I've taken is just to work with what the child has currently. And if your child's attention span is literally only 10 seconds, then work with that 10 seconds. So find a task that's 10 seconds long and have your child try and remain calm and complete that task. And then little by little, try and lengthen the time of the task. And it's just, attention is, to me, I almost think of it like a muscle. You can strengthen it the more you use it. The more you attempt to focus and the longer focus you can have, then your attention's only going to get better and better. So another way to work with attention is, oh, and I just got a message on Instagram. I've got 1 minute and 45 seconds left on Instagram, guys. So I guess the storage of the Instagram live stream is closing out, running to an end. So in 1 minute and 30 seconds, I believe this may just kind of shut off. So please, please, please come on over to the YouTube channel, and I will continue. There's a couple other questions coming in, so I will continue to answer these questions on the YouTube channel. So I'm very sorry about that. I don't quite know how to fix that or what to do with it. But like I said, I am live here on YouTube, so come on over to the YouTube channel. It's Raising Beautiful Little Minds. I'm doing a live stream, OT Steph, and I'll go back to the question now, but I just wanted to give a heads up in case that pops off. But attention. So another way to work on attention, especially with ADHD, children who are diagnosed with ADHD. So they're obviously seeking the movement. Their body's on the go, it needs movement. So one of the ways that I work with that is I give them that movement. So I wouldn't have a kid come to my clinic who I know is hyperactive and sit them down in a chair and give them a 10-minute task and say, okay, just sit here, do this, it's going to be impossible. We're not going to get anywhere with that because their bodies can't sit there and focus for that long. So what I would typically do is maybe bring them into a gym. I would give them lots of movement. I'd give them crawling activities, obstacle courses, all different kinds of things to kind of feed what they're looking for, that movement. And then we would move over to the table, we would do a task for as long as they could possibly manage, and then it's back to the gym again. It's back to running around, it's back to pushing heavy balls, it's back to, you know, whatever I can do to kind of get their energy at a better level to sit and do something, and then we just kind of extend that. There's also a matter of visual attention, which is a little bit different, but I see this problem a lot with children who have ADD or ADHD, and that is just their ability to have their eyes focus on one specific point for an extended period of time. So if you think about it, if your body's doing this, your eyes are doing the same thing. So for me to put like a task down in front of a child where their eyes aren't even able to fixate on that task for more than a couple seconds, how would you expect them to be able to complete that task? And there's actually a really cool way that that can be worked on, the visual attention. And I wish I had it here to show you. I may be able to pull it up on Google real quick. Okay, so this is a picture of a pen light, and at the clinic I use these. Basically it's just a little flashlight that you hold up, and you can get different toppers for them. So like I have these little animal, giraffe, lion toppers, and when you click that flashlight button, they light up at the top. So what I'll do at the clinic is I'll dim the lights, not pitch black dark, but I'll dim the lights, and what that's going to do is it's going to remove any visual distractions in the room. So I am trying to draw their focus and draw their attention in on this pen light and make it the only thing that is visible to them. Then what I'll work on is seeing if they can watch the flashlight. That's basically it. I may hold it still, I may move it around depending on, you know, still is obviously easier to watch than something that's moving around. So we would start with the easier, move to the harder, and I may see that I'm only getting a visual attention span of 6-7 seconds. So it's just a matter of doing it and practicing and increasing that visual attention span to a more functional level, and then eventually, you know, turning on the lights and seeing if we can transition that to an actual sit-down task at the table where they can sit and look at something for more than a couple of seconds. And that usually shows some improvement. But like I said, I'll pop this disclaimer up again. That is a method I use in the clinic. However, I do insist that you talk to a pediatrician or you go see an actual occupational therapist before you try any of these things. And if you do want to try these things, it is at your own risk. Like I said, I'm not assessing your child. This specific one, it could be harmful if there is something eye-related, eye problem going on with your child where a bright light may bother their eyes. So I just wanted to pop this up real quick to ensure that, you know, nothing that I am saying here will be used in a manner that could harm a child or anything like that. That's definitely not my aim with doing this video. So I hope I answered your question there. And I am currently now offline on Instagram. I'm only here with those of you checking out the YouTube channel, so hello everybody. I have one more question, and it is, what age should a child hold a crayon correctly? So the development of pencil grasp or crayon grasp or marker grasp, it has a sequential path that most children will usually follow. Maybe I can grab a marker to show you guys. So the typical thing when you first place a crayon, pencil, marker into your child's hand, this is what you're going to see. You're going to see a gross palmar grasp of them grasping it like this and then writing on a paper like this. And that's, I mean, most parents don't think to put a marker in their 2-year-old child's hand, just because that can get extremely messy. However, at the age of about 2 years old, they should be able to grasp a marker, place it to a paper, and even just make a little mark or a dot like that. Where you want to go from there, and I may pull up a chart to help, just to kind of help give you a visual. See if I can find a good one. There we go. So I'm going to switch it over to the monitor for a second. So this says 1 to 1.5 years. That's that cylindrical grasp, or that gross palmar grasp that I was talking about. Around the age of 2, you're going to want to see this gross palmar grasp kind of flip over like this. So we're not really looking for a mature pencil grasp like this yet, but we are looking for them to go from doing this, scribbling on a paper, to flip over to doing this. This is obviously still a very immature grasp. We would not want to see someone, you know, in grade school writing their papers like this or anything, but this is the sequential development of the grasp pattern. After that, what you're going to want to see is the pen. It's hard to show on the computer. I don't know which way to put my hand to show it best, but you're going to want to, there we go. You're going to want to see the upper portion of that pen start resting in between the thumb and the index finger. Let me make this full screen again, so maybe that'll help. So before it was this, but turned this way. Now we're going to want to start seeing that upper portion of the marker resting in between the index finger and the thumb. And this is going to happen probably 3 to 4 years. You're going to see something like this. The other fingers, that's okay if they're there. The big thing is we want to move from this to kind of flipping it this way. A mature pencil grasp is called a dynamic tripod grip. And that's basically going to be a pinch of your, goodness, I can't figure out where the camera is. A pinch of your index finger and your thumb is the primary grasp on that pen, while it rests on the distal knuckle of your third finger. And that's going to be a mature pencil grasp. Now, I know adults who kind of have weird, funky, even a thumb wrap on their pencil, and they write functionally. You know, I can still read their handwriting. But we do want to get as close to as possible as developing this tripod grasp, because this does give you the best precision of handwriting and things like that. So if your child's already struggling with handwriting and they come in to see me and I see them pick up their pen like this, then I'm kind of like, well, you know, that's probably where some of the issue is stemming from, is just their grasp on the pencil is not the most efficient grasp. So I hope that answers your question. So what age should a child hold a crayon correctly? I just realized I never put that up on the screen. What age should your child hold a crayon correctly? I would say between age 4 and age 5 is when you're going to be looking for that dynamic tripod grip. However, holding a crayon correctly for a 3-year-old, you know, may look like this, and then even before that it may look like this. So it just depends on how old your child is and what the specific developmental level of their graphs should be, whether or not they are on the right track to being able to hold that correctly in the future. I hope that answered your question. And I can no longer see the Instagram feed. We are reaching the hour mark right about now. If there are any other questions, please feel free to type them in the chat. I think if there are no other questions, we may be getting ready to close it up. I know I feel like I've talked a bunch. I hope some of it was helpful. So yeah, what we'll do, how about this? I will take a short break. I'm gonna pop this disclaimer up just for funsies. And oh, wait a minute. I just had a question come in. What is the general scope of my field, out of curiosity? The scope of my field. So occupational therapy depends on your definition of scope. So if you're looking, so occupational therapy, I can see people from birth all the way through adolescence, through geriatric population, all the way to elderly. So the scope as far as ages go, I'm able to see anybody. As far as diagnoses go, it's pretty much the same thing. I can work with children in a pediatric setting where you're going to see diagnoses like autism, cerebral palsy, you're going to see ADHD, you're going to see oppositional defiant disorder, those kind of things. But I can also work in an adult setting. I do work in an adult setting on the weekend, actually. I work in a hospital where, you know, I'm part of the rehabilitation there for helping people who may have just had a hip surgery or hip fracture, a cardiac surgery, people who've had a stroke or brain injury. I would be part of that team rehabilitating them to regain as much as they can. And in that scope, you know, physical therapy are the ones that's going to be, that's the more well-known profession. They're going to help, you know, teach people how to walk, teach them gait training and balance and endurance, things like that. Where in the hospital setting, my main goal is to get people back to doing what they were doing. So, not the most glamorous, but things like being able to dress yourself, being able to brush your teeth again, being able to get in and out of the shower safely, get in and off the toilet safely. And then just like with the kids, you know, if someone's having a difficult time going to the bathroom, going on the toilet, we'll just go with that one. It's my job to assess why. Why is this hard for them? Is it hard for them because they're unable to sit up and get down? Is it hard for them because they had a stroke and now they have left-sided weakness? Is it hard for them because cognitively there's something going on where they don't understand the task or the sequencing of the task? So much like when I work with the children, it's the same thing. It's trying to find out what the problem is and then treating that specific problem to get them to a level of, hopefully back to the level of independence they were before they came to the hospital. And then, you know, if rehabilitating the person is not the best approach to that, I also can offer adaptive equipment, adaptive devices. Occupational therapists can go into your home and, you know, show you the best ways to set up furniture, to bring certain types of beds, certain types of chairs, different kinds of toilet seats, you know, anything you can think of. It's basically my job to help that person get back to being as independent as they possibly can. So I don't know if that answers your question about the scope. If you had something more specific about that, please feel free to just type it out and I'll try and answer that best I can. And I'm going to take a sip of my water. So my throat is drying up. And while I do that, we're just going to hang out for a minute. If anybody has any other questions, or if anybody would like to add something more specific to a previous question, feel free. And guys, I'm really bad about putting up the question that I'm answering. Let's do that right now. I'll get better at it, I promise. And for those of you who are watching, this is the first time that we're doing this live. We're doing a Q&A session live, but we hope to continue doing it. I should be live again next week, Saturday, same time, 1 p.m. Eastern Standard Time. So if you liked what you saw here and maybe you think of a question during the week, please pop on, ask it. I'd be happy to answer it next week, same time on the stream. If you know anybody who might benefit from this kind of Q&A or advice, let them know about the stream. They can subscribe to Beautiful Little Minds, or Raising Beautiful Little Minds, I'm sorry, on the YouTube channel and get notifications for when we will be streaming, things like that. This particular stream also should be available to you in video form if you needed to go back and watch anything. I will be uploading it to my own YouTube channel, which is OT Steph, which if you look in the description, there should be a link under YouTube OT Steph. I don't know exactly when that's going to go up, but I know it will be going up there, so keep an eye out for that if you do want to come back and rewind and watch anything or anything like that. I also do a little bit of shameless self-promotion. On top of the live streams, the live Q&A sessions, I do plan on uploading some basically pre-scripted videos of me explaining some of these different concepts in more detail, being able to show a little bit more visuals through post-video editing, things like that. So if you're interested in that, subscribe to OT Steph, take a look there. There's not too much up there right now. Like I said, we're just getting started, but it will be coming in the future. So if you're interested in gaining that information, you know, go check it out, subscribe, and there should be lots more coming in the future. This is just kind of getting its feet on the ground, but I think I'm real excited to keep going with it and grow it, make it bigger, things like that. So does anybody have anything else? It doesn't seem like anybody is adding anything to the chat. We were streaming to YouTube and Instagram at the same time, but unfortunately I guess the stream for Instagram can't last that long. So I believe next week we are going to be just streaming to YouTube. That way, you know, everyone can kind of come to the same place and view it. So, you know, share the link, share it with people who you think might want to see this or benefit from it, and yeah. I think we'll give it one more minute just in case somebody shy decides to speak up. Thank you guys so much for coming. It was a lot of fun. I haven't done this before. I don't normally do this kind of thing, so but I had a lot of fun with it, and I'm looking forward to doing it again for sure. But bring your questions, you know, make a list, you know, fire them off. I'm happy to stay even longer next time if there's enough people, enough want for it. So, but I think that's about it thank you for tuning in. I appreciate everybody watching and asking your questions, and I hope I was helpful. Share this around. Tune in again next week, same time, Saturday. And I hope to see you all then. Have a good rest of your week. Check out my Facebook and my YouTube channel. Links in the description. I'll be posting stuff on there as well. And have a good one. Thanks again. And I don't know how to turn it off. Okay, here we go. All right, have a good one. Thanks again.